morning, everyone. During this COVID pandemic time, there is a lot of panic among every individual regarding various health conditions. And there is severe panic among public about some musculoskeletal conditions also. So today's discussion is to provide reassurance to the population, general population, regarding musculoskeletal conditions. And to do the same, we have our Chief Orthopedic Surgeon, Dr. Aravindan Selvaraj with us. Morning.
Good morning, Dr. Keerthivasan. Good morning, everyone. As Dr. Keerthivasan mentioned, the COVID has affected almost all the systems in the body. While we are getting carried away with the lung infections, which is the predominant symptom, there are other systems are also affected. One of the systems being the musculoskeletal system, which means muscles, bone, and the joints. So let us discuss about this system involvement in COVID. And this is mainly to reassure the public and then give them the correct information. Thank you.
So regarding patients who are recovered from COVID, what are the common symptoms they present to our OPD, the orthopedic OPD?
See, in the orthopedic OPD, which is we mainly deal with the muscles, bone, and the joint, what we see is nearly 50% of the people who are recovered from the COVID has got some symptoms or other with pain in the muscles, bone, or the joints, which will be presented like a shoulder pain, back pain, knee pain, the finger joints pain and all. This is after the patients have recovered from the COVID. Whereas when the patients are admitted in the hospital also, we see patients are complaining of bone, muscle, and joint pain. So we can discuss about why the patients, whether they get the bone and joint pain during the COVID active phase itself, or do they get into post-recovery from the COVID?
Yes. So what can be the cause of these symptoms, like muscle pain or joint pain in the patients who recovered from COVID or the COVID patients?
See, during the COVID phase, that is the acute phase, when the patients are majority of the time as an inpatient in the hospital, or whether they are being home quarantined when there's an active phase, the inflammatory mediators, the cytokine, we call this a cytokine storm, or when there is a very high amount of cytokines in the system, that cytokine can get deposited, it can cause the musculoskeletal symptoms as well. So during that time, they can present with acute pain in the muscles, bone, or the joints. That is, we call this in the medical side as an inflammatory phase. When the active inflammation, active disease process is going on, we see patients having these symptoms. That is the direct cause of patients having muscle, bone, and joint pain during the COVID phase. Or there can be indirect causes as well. For example, many patients are being nursed in the prone position, that is with the face and belly down to improve the oxygenation to the lungs. Because of the prone position or because of the immobility, also they get a lot of muscle, bone, and joint pain. This problem gets complicated in patients who are having already a bone and joint problem like rheumatoid arthritis or osteoarthritis or osteoporosis, because this immobility aggravates the symptoms. This is during the acute or inflammatory phase. Whereas when the patients have recovered well, gone back, and then when they come for the routine regular follow-up with the physician, then we see quite a few patients with symptoms of fatigue, generalized fatigue in the body, with specific bone and joint pain as well. This is what we call as a reactive arthritis or reactive arthralgia. One common thing most of us will know when the patients recover from viral infections like a chikungunya or the other viral infections like a dengue and all, they get this bone and joint pain after 3 to 6 months time. So this kind of picture also we see increasingly common in COVID, starts after a month or it can come after even after 3 months. This is called a reactive arthropathy. Medically, if it's a reactive arthropathy, what it means is the original infection or inflammatory process which has triggered has settled down, but patients present with this multiple bone and joint symptoms. This is because of the, when there is any infection, whether it's a dengue or chikungunya or COVID, when there's a virus infection, the body responds. The immune system responds. Then this virus antigen and the immune antibodies, they form complexes. And these complexes that can get easily deposited on the linings surrounding the joints. That's why they get this problem we call it as a reactive arthritis or reactive arthralgia.
So about the prone position, some patients who are recovered from severe COVID, especially when they were in prone position, some of the patients report to us with some tingling or numbness, over the fingers, especially in the little finger and the ring finger, and also in the tingling and numbness in the foot. Is there any particular cause for that thing?
Yes. So this is one of the annoying problem for patients when they have recovered from the COVID, because when they are in the prone position, they may get tingling or numbness in the mainly in the little and the ring finger. There's a ulnar nerve. There's a nerve which supplies sensation to these fingers, the little finger and the ring finger, which is comes around the elbow under the bone. So when the patients are nursed in the prone position, there will be pressures or undue pressure on these areas. So the nerve is under a lot of pressure there. In spite of our best nursing efforts to frequently change the position of the patient and the limbs during this nursing or the prone position nursing, some patients develop this ulnar nerve symptoms in the hand. Also in the foot also, there are certain areas which are prone to compression neuropathy, where the nerves become under pressure. So then we see patients with the foot and ankle symptoms also. This is the indirect effect of nursing these patients in prone position or prolonged immobility.
And when we talk about steroids, there is a general apprehension about the steroid intake among public. But during COVID, we have to use steroids for the management of COVID. Is there any consequences of steroid use regarding musculoskeletal system, regarding muscle strength or bone health?
Yeah, steroid, we have to accept that the steroid is a life-saving drug in COVID in properly selected patients at appropriate doses. ரொம்ப கேர்ஃபுல்லாக இருக்கணும். ஏன்னா ஸ்டீராய்ட்னாலே நம்ம மக்களுக்கு ஃபர்ஸ்ட் ஆஃப் ஆல் ஒரு நெகட்டிவ் பர்செப்ஷன் இருந்தது. பட் டூரிங் த கோவிட் டைம்ஸ் சம் ஆஃப் த பேஷண்ட் ஸ்டீராய்டு லைஃப் சேவிங் ட்ரக்னால அதை டோசஸ் பியாண்ட் த ப்ரிஸ்கிரைப் டோஸ், அதாவது அவங்க ட்ரீட்டிங் டாக்டர் ப்ரிஸ்கிரைப் பண்ண டோஸை விட செல்ஃப் மெடிகேஷன் நிறைய ஹை டோசஸ்ல எடுத்துட்டு இருக்காங்க. இது ஒரு பெரிய சேலஞ்ச். ஃபர்ஸ்ட் ஆஃப் ஆல் ஸ்டீராய்டு இஸ் டெஃபினெட்லி எ லைஃப் சேவிங் ட்ரக், உயிரை காப்பாற்றக்கூடிய ட்ரக் இன் கோவிட் இன் ப்ராப்பர்லி செலக்டட் பேஷண்ட்ஸ். எந்த பேஷண்ட்டுக்கு எந்த டைம்ல எந்த டோஸ்ல கொடுக்குறோங்கிறது ரொம்ப ரொம்ப இம்பார்ட்டன்ட். பட் the steroid sometimes prolonged high dose of steroids can cause the muscle fibers sarcomeres and so on, அதோட weakness, and prolonged steroid uses sometimes can cause the bone weakness as well, like osteopenia. அதனால the unduly prolonged period of steroid use in high doses can cause this muscle and bone and joint problem. So my suggestion to people is steroid is, yes, it is an essential life-saving drug in COVID management, but please take it under the prescription of the physician.
Among people who are visiting our OPD for muscle pain, generally அவங்க கேட்குற இன்னொரு கொஸ்டின் இந்த பெயின் is it going to be lifelong இருக்குமா, நம்ம லைஃப் ஸ்டைல் சேஞ்சஸ் தேவையா, should I switch my job, இந்த மாதிரிலாம் கொஸ்டின் கேட்குறாங்க. இதோட லாங் டேர்ம் ப்ரோக்னோசிஸ் எப்படி இருக்கு? ஒன்ஸ் பேஷண்ட் டெவலப் மசில் பெயின் ஆர் ஜாயிண்ட் பெயின், அது ரெக்கவர் ஆகிற சான்ஸ் எப்படி இருக்கு? லாங் டேர்ம் ப்ராசஸ் எப்படி இருக்கு?
One good thing, at least as of now, see we are still in the COVID active phase. First wave முடிஞ்சது, we recovered partially, now the second wave has come. So during the next few months, we can say that we, the society and the public, we are still in the COVID recovery phase. My hope and also it will become true as well is the musculoskeletal symptoms. Post-COVID patients having myalgia, the bone and joint pain can be like a reactive arthralgia pain, where for example chikungunya people get this bone and joint pain, which can last for 3 to 6 months or even 9 months. But completely it gets resolved. So you can, at this point of time, we can say that it's a self-limiting condition. But one of the things we have to wait and watch. The symptoms, for example, rheumatoid arthritis, rheumatoid arthritis is an autoimmune disorder, where body's own immune system, they act against the body's own joint linings. That's why the rheumatoid arthritis வருது. The immune response to the COVID infection, the COVID body or the immune system it responds to that. So whether it will lead to, whether it can be a trigger for rheumatoid arthritis. Some of the early research papers have cautioned that we have to, the medical fraternity like orthopedic surgeons and rheumatologists, we have to wait and watch to see this immune response, the body or the immune response, whether it is going to be self-limiting or it can lead to development of the rheumatoid arthritis or the non-rheumatoid arthritis conditions, whether it will lead to, we have to wait and watch. Fortunately, majority of the patients now we have seen who have recovered from the COVID, who present with muscle pain and bone and joint pain, it settles down over a period of a few weeks to a month. So that we can be reassured, but we will keep that in mind. We'll continue to observe that for a year to see whether patients develop full-blown rheumatoid arthritis in future or not.
So that is reassuring to hear, sir. Generally, in patients கேட்குற question, already osteoarthritis இருக்கு, இல்ல already I have rheumatoid arthritis. இந்த மாதிரி இருந்துச்சுன்னா கோவிட்ல இருந்து ரெக்கவர் ஆனதுக்கு அப்புறம் இந்த ஆல்ரெடி இருக்க டிசீஸ் ப்ராசஸ்ல எதுவும் சேஞ்ச் வரலாமா, டிசீஸ் அதிகமாகலாமா, இல்ல அதோட ப்ராக்னோசிஸ் எப்படி இருக்கும் அப்படின்றதும் நெக்ஸ்ட் क्वेश्चन இருக்கு.
See, the osteoarthritis osteoarthritisங்கிறது தமிழ்ல தேய்மானம் சொல்லுவோம். வயசு ஜாஸ்தியா இருக்கிறதுனால அந்த வேரண்டர்னால வர ஆர்த்ரைட்டிஸ். அதனால கோவிட் டைம்ல பிகாஸ் ஆஃப் கோவிடோட the nursing position plus immobilityனால symptoms ஜாஸ்தி ஆகுமே ஒழிய கோவிட்னால அந்த osteoarthritis itself அந்த கண்டிஷனே ராபிடா டிட்டீரியேட் ஆகும்னா கிடையாது. That is about osteoarthritis, that is age-related wear and tear in the bone and the joints. Whereas the rheumatoid arthritis, rheumatoid arthritis is an autoimmune condition, and the COVID actively stimulates the immune system. There's a possibility that patients who are having already rheumatoid arthritis, there is a possibility of exacerbation. There's a worsening of this bone and joint symptoms. It can happen. But the hope is, the other thing as I mentioned, patients who are known or prone to develop this rheumatoid arthritis, the autoimmune individuals, அவங்களுக்கு ஒரு triggering factor இருக்குமா இந்த rheumatoid arthritis in futureல வரதுக்குங்கிறது we have to wait and watch. The osteoarthritis, the age-related wear and tear should not become worse. But temporarily, yes, the pain may increase. Also, patients who are having already osteoporosis or osteopenia and the weak bones இருக்கவங்களுக்கு இந்த கோவிட்னால வர ஃபர்ஸ்ட் ஆஃப் ஆல் அந்த ஆக்டிவ் ஃபேஸ்ல அவங்க மொபிலைசேஷன் கம்மியா இருக்கிறதுனால சிம்டம்ஸ் ஜாஸ்தி ஆகலாம், அந்த சமயத்துலையும் போன் வீக்னஸ் ஜாஸ்தி ஆகலாம், அல்லது லேட்டர் ஆன் when they are having symptoms like fatigue and all, அவங்க நார்மல் எக்ஸசைஸ்லாம் பண்ணாம அந்த பண்ண முடியறதுக்கு கஷ்டமா இருக்கப்போ போன் அண்ட் ஜாயிண்ட் ஸ்டிஃப்னஸ் அண்ட் பெயின் அதிகமாகிறதுக்கு சான்ஸ் இருக்கு.
இன் கேஸ் பேஷண்ட் ஒரு பர்சிஸ்டன்டா பெயின் இருக்கு, more than 2 months or 3 months பெயின் இருக்குன்னா, do you have to do any investigations, any blood investigations, x-rays இந்த மாதிரி ஏதோ எடுக்க தேவைப்படுமா?
See, so when the patients come to me after a month or 2 after the COVID, and அவங்களுக்கு generalized musculoskeletal symptoms, அதாவது பாடி ஃபுல்லா பெயினா இருக்கு, பிளஸ் ஆர் small joints of the hands, morning early morning stiffness of the fingers, அதெல்லாம் இருக்கிறப்ப what I am concerned is whether the patient is having reactive arthritis and the autoimmune conditions-னால அது reactive arthralgia வந்திருக்காங்க. இல்ல I do simple blood tests like the inflammatory markers, the inflammation whether it's still active or not, ESR, CRP plus rheumatoid factor, anti-CCP, the simple test I do it. Majority of the time x-rays may not be necessary, but in the patients already having osteoarthritis adilla irukanga, so in order to corroborate my findings, I combine with the blood test as well as the x-rays so that I can give a proper explanation to the people whether the condition is going to be self-limiting or they have to come for regular follow-up. So there is no active, there's not lot of tests you need to do. Most of the time, I reassure the people that it should settle down, and also doing a simple blood test to give you a prognosis. But the one important advice I give to the people is, they should gradually try to doing the exercises. That is very important.
So, இப்போ கோவிட் அஃபெக்ட் ஆகிற பேஷண்ட்ஸ்லாம் பார்த்தா மோஸ்ட்லி எல்டர்லி, இப்போ செகண்ட் வேவ்ல யங்கர் பேஷண்ட்ஸ் ஆர் ஆல்சோ அஃபெக்டட். பட் இருந்தாலும் எல்டர்லி பாப்புலேஷன் தான் ரொம்ப அஃபெக்ட் ஆகிறாங்க. அவங்க ஆல்ரெடி தே ஹேவ் ஆஸ்டியோ ஆர்த்ரைட்டிஸ், அந்த முட்டி தேய்மானம் அந்த மாதிரி உள்ள பெயினும் இருக்கு. இப்போ அவங்களுக்கு அந்த பெயின் ஆஸ்டியோ ஆர்த்ரைட்டிஸ் பெயின் தான் அக்ரவேட் ஆயிடுச்சா, இல்லை இது போஸ்ட் வைரல் ஆர்த்ராலஜி இந்த கோவிட் ரிலேட்டட் பெயினா அப்படின்னு டிஃபரன்ஷியேட் பண்ணுறதுக்கு எதுவும் சிம்டமேட்டிக்காக எதுவும் சான்ஸ் இருக்காது? பேஷண்ட்டே ரியலைஸ் பண்ணுறதுக்கு எதுவும் வழி இருக்காது?
It is possible. But when the patients recover from the COVID, they undergo a lot of mental trauma, and then they get worried about so many things. So from as a clinician's perspective, by doing the blood test and the X-ray, we can, to a large extent, we can understand whether the patients or inflammatory phase, though it's acute phase has settled down, recovery phase la irukangala illa this is going to be a long lasting thing. Now we can do simple blood tests and the X-rays. That alone is enough at this stage now. But one of the things I mentioned about the exercises, when the patients recover, usually even after a month, quite a few people get the muscle fatigue. But they have to start doing the exercises somewhere. Otherwise, the bone and the joint stiffness is the main problem. So the exercises can be of two types. It can be a stretching exercise or strengthening exercises. Stretching exercises like taking the body joints through all movements. That is, even if they were, for example, they are doing before COVID, they were doing 30 minutes a day. Now they have to start with at least 10 minutes a day. 10 minutes of gentle, slow stretching exercises, so that the joint or the stiffness, already bone and joint muscle pain இருக்கு, நான் கோவிட்ல ரிகவர் ஆயிருக்கேன் அப்படின்னு ஒண்ணுமே பண்ணாம இருக்குது, இட்ஸ் நாட் ரைட். ஏன்னா the immobility plus also இந்த கோவிட் பேஷண்ட்ஸ்லாம் ரிகவர் ஆகிறப்ப அந்த thrombotic staging, they are prone to develop blood clots. The doctor normally gives the blood thinners. அதெல்லாம் அது blood thinners எடுக்கிறது மட்டும் இல்லாம ஒரு small you have to start somewhere doing the exercises. The stretching and strengthening exercises play an important role in the recovery, in particular to the bone and the joint system.
So it's a very important information, sir. Another, they taking medicines, they have to move their muscles, கால் கை அதெல்லாம் மூவ் பண்ணும்போது தான் இந்த thrombotic events prevent பண்ணலாம். Thank you, sir. And another important question, ரொம்ப காமனா பேஷண்ட்ஸ் கேட்கறது இதுதான். ஆர்த்தோ ஓபிக்கு வரவங்களும் சரி, இல்லை நம்ம சர்ஜரி ஃபாலோ அப் இவங்க வர பேஷண்ட்ஸும் சரி, regarding vaccine, we have a surgery, ortho fracture ஆகி சர்ஜரி பண்ணியிருக்கோம், இல்லை ரீப்ளேஸ்மெண்ட் பண்ணியிருக்கோம், ஆர்த்ரோஸ்கோபி பண்ணியிருக்கோம், நாங்கள் வேக்சின் எடுத்துக்கலாமா? இது ரொம்ப காமன் கொஸ்டினாக இருக்குது. வாட்ஸ் யுவர் டேக் ஆன் திஸ் கொஸ்டின்?
One of the things I see in India is people want to find all sort of excuses to not to get vaccinated. This is not the right approach. See, with the COVID or the course and prognosis, first wave, nobody expected second wave will be this severe and it will affect the young people, because the virus is also mutating. Still, even now, we are not sure whether there is going to be a third wave, the severity, whom it is going to affect. And also, because of the infrastructure issues, a lot of places face challenges like whether oxygen or the drugs and all. But what is within our control is the vaccine. Vaccine is the one, as far as the COVID is concerned, the only thing is which is under our control, within the public's control, is the getting vaccination done. So please clear all the misconceptions about the vaccination. Suppose patients over இன்னொரு கொஸ்டின் கேட்குறாங்க, in Kaveri we have done lot of patients with the joint replacement. டாக்டர் போன வருஷம் joint replacement பண்ணீங்க நீங்க, இப்போ எனக்கு நான் வேக்சின் போட்டுக்கலாமான்னு? Absolutely there is no correlation. So it's a joint replacement, but what we do vaccination is body or the natural immune response create பண்ணது தான் the vaccination. So I suggest that all the people, majority of them, almost all of them, unless there is specific contraindication, everybody should get vaccinated. Please don't have unnecessary doubts, and also please don't think of any excuses. Please go ahead and get vaccination done.
ஸோ இந்த கொஸ்டினே இன்னொரு ஆஸ்பெக்ட்லையும் கேட்குறாங்க சார். இப்போ பேஷண்ட் ஒரு எல்டர்லி பேஷண்ட்ஸ் 80 இயர்ஸ் 75 இயர்ஸ் தே ஹேவ் ஹிப் ஃப்ராக்சர், ஒரு ஆல்மோஸ்ட் லைஃப் த்ரெட்டனிங் சுச்சுவேஷன்ல இருந்தாலும் இந்த சுச்சுவேஷன்ல ஆப்ரேட் பண்ணிக்கலாமா, சர்ஜரி பண்ணலாமா அப்படின்றது ஒரு கொஸ்டினா இருக்குது. அது வாட்ஸ் யுவர் டேக் ஆன் திஸ் டாபிக்?
See, this is one of the difficult clinical dilemma we faced in the first wave, because when the COVID struck in last year, March and April, many of the healthcare institutions also did not know how to handle that, right? But one thing at Kaveri, we have from the day one, from March 2020, is all the non-COVID emergencies, right? All the non-COVID emergencies should be treated as emergency, whether the patient has got COVID or not COVID. Right? ஒரு patient வந்து suppose வந்து elderly person வந்து hip fracture ஓட வராங்க அப்படின்னா, normally our recommendation is to get the surgery within 24 to 48 hours. So, if suppose they are on the preoperative test appo, if they are found to be COVID positive nalum, we wait for a day or two to give the relevant medications to reduce the viral overload, and we go ahead with the surgery as soon as the patient is fit. But in the perception, sometimes the people ask, எதுக்கு டாக்டர் இந்த கோவிட் பாசிட்டிவ் எதுக்கு இந்த சர்ஜரி பண்ணணுமா அப்படின்னு சொல்லிட்டு. எஸ், இட்ஸ் an elderly patient, a person with a hip fracture is a surgical emergency. We have to do the surgery, right? That's the only way when they recover from the COVID, they can get back on their feet. So, and definitely during the second wave, even though the first wave, quite a few healthcare institutions were hesitant to offer this non-COVID emergency services for the patients who are tested COVID. But in the second wave, most of the hospitals, they continue to offer, so for example, you would have read in the papers, we have done even the patients who have COVID recovered, we have done mother and daughter, kidney transplants also we have done. So we are continuing to do all the non-COVID emergency medical care, even in patients who are found to be COVID positive or who have recovered from the COVID. This is very important because COVID is not going to go away soon. COVID is going to stay in the community for quite some time to come. So particularly the medical fraternity, we have to brace ourselves and face this, and then how do we manage simultaneously all the non-COVID medical illness as well. And public also, please don't be afraid. Yes, if somebody in your family or the hospitalized patients become COVID positive, they've got other illnesses should not be ignored.
So yes sir, நீங்கள் சொன்ன மாதிரி இப்போ ஃபர்ஸ்ட் வேவ் முடிச்சுட்டு நம்ம ஃபர்ஸ்ட் வேவ் கிளியர் ஆகிற டைமில் பார்த்தா இந்த நான் கோவிட் எமர்ஜென்சிஸ்லாம் காம்ப்ளிகேட்டான பேஷண்ட்ஸ் எல்லாமே நிறைய நம்ம ஹேண்டில் பண்ணுற மாதிரி இருந்தது. பட் தேங்க்ஃபுல்லி இந்த செகண்ட் வேவ்ல மோஸ்ட் ஆஃப் த எமர்ஜென்சிஸ்லாம் இப்போ டேக்கிள் பண்ணுற மாதிரி இருக்குது. தட்ஸ் அ குட் திங் சார். அப்புறம் இன்னொரு நியூட்ரிஷன் ரிலேட்டடாகவும் நிறைய கொஸ்டின்ஸ் இருக்குது. இப்போ ஸ்டீராய்ட்ஸ் ரிலேட்டடாக வர டிஃபிஷியன்சி, அதுக்கு ஆஸ்டியோபோரோசிஸ் அந்த மாதிரி டெவலப் ஆகுறதா, அதுக்கு எதுவும் பிளட் டெஸ்ட் இல்லை டெக்ஸா ஸ்கேன் அது பண்ணணுமா அப்படின்றது கேட்குறாங்க. ப்ளஸ் கால்சியம் சப்ளிமெண்ட்ஸ் எதுவும் தேவையா? ரெகுலராகவே ஸ்டீராய்ட்ஸ் எடுத்துக்கிட்டாலே கூட கால்சியம் சப்ளிமெண்ட்டுமா எடுத்துக்கணுமா?
See, let us look at this. The bone weakness, even normal circumstances, particularly in post-menopausal women, because of the hormonal changes, estrogen is a powerful stimulator for the bone. The menopause around that time, the estrogen effect கம்மியாகிறதுனால the perimenopausal or post-menopausal women க்கு நம்ம the osteoporosis screening test பண்றோம் நம்ம, where we do the calcium, vitamin D and the DEXA scan. So the patients, suppose if the patients continue to have even after recovering from the COVID muscle and the bone and joint pain, we do recommend having the simple blood test to see the calcium, vitamin D and the DEXA scan, whether the patients who are known to develop the bone weakness already, COVID வந்ததுனால அந்த osteoporosis அந்த இது aggravate ஆகாம பண்றதுக்கு simple blood test பண்ணிட்டு, based on the blood test we can give the supplements. And also one of the important question, the vitamin D. That's a common question we get asked. See, unfortunately, last over 15 to 16 months, already in India, vitamin D deficiency is very, very common. Majority of the Indian population has got the vitamin D deficiency. Now, because of the COVID, most of us are confined to the home. So there's lack of exposure to the sunlight and the lack of exercises. The vitamin D deficiency and its related problems also has becoming a bit acute. So if the patients continue to have the bone and joint related problems of the muscle pain, get the vitamin D also tested, and vitamin D supplement is one of the easiest thing to take. So we have to keep that in mind. Bone and joint kana health and nutrition. If you are not able to have it with a regular diet, please take the supplements under the guidance of a doctor.
So இது வரைக்கும் பார்த்த எல்லாமே reassuring. இது ஒரு self limiting condition. நம்ம regular pain killers அதிலே settle ஆயிடும் அப்படிதான் இருந்தது. இப்போ which are all conditions patient வந்து should meet the primary physician or an orthopedician? எந்த கண்டிஷன்ஸ்ல patient வந்து பார்க்கணும், டாக்டர் கன்சல்ட் பண்ணணும்?
See, we say it's a self-limiting condition. Yes, the post-COVID bone and the joint pain or muscle pain. But the self-limiting illama, even after taking a simple methods like taking a paracetamol and taking this, if it does not settle, then you should consult a treating physician or the orthopedic surgeon. Because the whole idea of our medical management is how do we get the patients back to their pre-COVID mobility status so that they become fully functional. So anything which is limiting that. So for example, we see patients a lot of times in the shortness of breath that continues for quite some time, 4 to 6 weeks time. Then they should see the treating doctor, the pulmonologist, to see whether the residual lung function எப்படி இருக்கு அப்படின்னு சொல்லிட்டு. But if they that is one thing, and also to monitor the progress, inflammatory markers, the blood thinners, and also from the bone and joint point of view, whether they have got a persistent bone and joint pain, they can consult the doctor. So in the name of by the fear of COVID, please don't ignore other associated illness or the symptoms which happen in the recovery phase. One of the other important things, Dr. Keerthi,
Yes, sir.
You are a spine specialist as well. I do see a lot of patients who have recovered from the COVID come back and present with the back pain, from the neck to the upper back to the lower back pain. So what is your experience?
So you have already exclusively, comprehensive எல்லாமே explain பண்ணிட்டீங்க சார். அது சொன்ன மாதிரியே தான். So back pain is more prevalent in public. Already 70%. The prevalence is almost 70%. இப்போ இந்த கோவிட் இருக்கும்போது அவங்க எடுக்க பெட் ரெஸ்ட் and also regular physiotherapy அது எல்லாமே இன்டரப்ட் ஆயிடுறதுனால they present with back pain. Also position, bed rest, prolonged supine positionலே இருக்குது and also prone position, இது எல்லாமே aggravating factors for back pain. ஸோ பெட் ரெஸ்ட்ல இருந்தாலுமே ஃப்ரீக்வெண்ட்டாக பொசிஷன் சேஞ்ச் பண்ணிக்கிறது, ப்ரோன் பொசிஷனில் இருந்தாலும் 2 hourly ஒன்ஸ் பொசிஷன் சேஞ்ச் பண்ணுறது, ஃபுல் இன்டென்சிவ் ஸ்ட்ரெங்தனிங் எக்ஸசைஸ் பண்ணனாலும் ஸ்ட்ரெச்சிங் எக்ஸசைஸ் அதெல்லாமே லெஸ் டிமாண்டிங், லங் ரெஸ்பிரேட்டரி லெஸ் டிமாண்டிங் எக்ஸசைசஸ் லைக் ஸ்ட்ரெச்சிங், ஃப்ளெக்சிபிலிட்டி எக்ஸசைசஸ் அண்ட் ரேஞ்ச் ஆஃப் மூவ்மெண்ட். சும்மா பெட்டில் உட்காந்துட்டே நம்ம லெக்ஸ் அப்பர் லிம்ஸ் மொபிலைஸ் பண்ணுறது, இதெல்லாம் பண்ணிட்டாலுமே we can prevent this back pain.
Yeah. See, and also many times the backache has got a psychological issue as well. The COVID has created so much of fear among the public, and then the fear psychosis plus the panic. You always feel tense. Many people I've seen with tense neck muscles and the headache and everything. It's also related to the psychological factor, right? This unfortunately COVID like pandemic is a once in a 100-year situation that we face. So what I suggest is let us face it, and then let us take the proper treatment, and let us collectively as a society we have to work towards defeating the COVID and get people back to their previous functional status, whether they are working or for any, we have to prepare the people to get back to their pre-COVID status. Thank you.
Thank you, sir. Thank you for our elaborate explanation, sir. Hope it's reassuring to our public and also to the healthcare personnel. Thank you.